Well, good afternoon, everyone, and thanks for joining us. With the start of the school year already underway in some parts of the state and many school districts ready to begin a new year in the coming week, MLive thought it would be helpful to answer some questions you might have on a topic that's obviously gotten a lot of interest in communities across the state, and that is mask policies in the classroom. And who better to explain why these policies are in place and how they're constructed than the people that are making these informed decisions. With us this afternoon are Ingham County Health Officer Linda Vale and Saline Area Schools Superintendent Steve Lotch. Linda and Steve, thank you both for joining us. You both didn't have anything else going on right now or recently. Is that right?
That's correct.
I'm kidding, of course. There's obviously a lot of guidance schools are receiving and taking in when making these policies. So I appreciate you both taking the time. And I thought maybe, Linda, you could get us started off here. Maybe for a lot of parents out there who are concerned about the rise in COVID cases and the Delta variant, I just wondered what you could offer to reassure parents that it's safe for their children to go back to school with the spread of the Delta variant across the state.
Well, I mean, we have the experience of using mitigation measures, and we have really an abundance of science behind them. I mean, we put together the articles and a bibliography of the science that supports this stuff, and it's, it is so very long. And not only that, there's a lot of them that are reviews and meta-analyses of 20, 30 other studies that basically support this. What we're seeing across the country is, a surge in cases, a rise in cases, and we're seeing that here in Michigan as well. And we don't want our kids to have another year of virtual learning. It is so very important this year, I think, to do everything in our power for our children to have face-to-face learning. And that really can be done safely if we adopt these mitigation measures. And so we have some kids that are unvaccinated because they can't be vaccinated yet. We have others that may not be able to be vaccinated because of true medical reasons that prohibit the vaccination. And so we are trying to do our best to protect vulnerable people, including the unvaccinated who can't be vaccinated, vulnerable parents, grandparents in our communities that get exposed when community transmission goes up, and really to just keep our kids in the classroom, but do so safely. And the science behind it is very strong that this works and can do that. And so to those parents, it's like, if we do this right and we do this safely, not only can your children be in face-to-face learning and get that quality face-to-face experience, but we can expect to do it safely.
Thanks, Linda. So, Steve, I wondered if you could take me through Saline Area Schools' mask policy for the coming year and how the district created its policy for wearing masks in the classroom and all of the different factors that were taken into consideration in its creation.
Yeah, thanks, Marty. Yeah, I can start with that. I'll start with the policy and the philosophy around it. It's kind of what Linda had said. We started with, how do we keep students in school 5 days a week? And we started there and we said, how do we do that with limited quarantining? How do we also keep our staff and students safe? And then we looked at, if transmission levels are low enough, would we be able to provide some choices? And so we looked at that, and then from that developed the policy as follows. Basically, we are, when it's students in grade 6 or lower, they will be masking in all phases, all transmission phases, all four, low, moderate, substantial, and high. And then in our grade 7 and higher, we are going with students are required masking, it's substantial or high. But if the phase would drop down to moderate or low, we would provide an optional mask phase option there. And then with the students in grade 6 and lower, once the vaccination process does take place, we would open that age group up to potentially having some mask options if we were in a low or moderate phase. So that's where we are right now. And then we point out to the public, like all superintendents are doing with their plans, these plans are subject to change. Just like the health departments are receiving different guidance and we are learning more, we need to adjust plans. And I think that's really important that this is still a novel virus. We're learning more. The health departments are learning more. And so as we work together to put together plans, they're subject to change based on different guidance and new guidance.
Thanks, Steve.
I think Steve brought up an important point that I'd like to add on. When I talk about keeping kids in school person to person and safely, one, the mask is going to protect them from getting ill. The other is we do have requirements under the administrative code to exclude kids from school when they have a communicable disease. This is not new to COVID. It's always been there. And also to exclude kids who are reasonably exposed and susceptible. And so we know that if we get kids in school with masks on, that reduces the travel of droplets and aerosols, because the mask itself is about source control. It keeps that from coming out of your mouth mostly and protects others around you, and also does have some limited protection coming in. When we have to quarantine based on a mask-free environment, we really, especially in a school classroom where there are a lot of kids for a long period of time, have to go with this 6 feet and 15 minutes. Some studies have shown that in classroom settings where we have a lot of strict mitigation measures, we can reduce that to under 3 feet. So within 3 feet, and that's much more doable in a classroom. So we're also looking at the impact of quarantines, really, in terms of making sure that kids stay in school, and those different metrics allowing us to keep more children in school, even if there is a case that comes into the schools.
Right.
Linda, I wanted to, you kind of got into this a little bit, but I wondered if you could give me a little bit of insight. I know in some counties across the state, they have issued mask mandates. In Ingham County, it's my understanding that is recommended by the health department. What type of consultation and sources are used in kind of sculpting this guidance that the health department comes up with? And are regional things taken into consideration when constructing that?
So the CDC has come up with really excellent guidance. The state of Michigan has adopted that guidance, and we all kind of try to take it and make it to where it's easy to understand and easy to digest within our districts. So we sent out a guidance document here. Like Washtenaw County, the vast majority of school districts in Ingham County have taken that recommendation and required masks in schools. So at this point in time, their health officer and myself have not issued mask mandates because largely our school districts have done so, as is recommended by the CDC, the state, the health department, the American Medical Association, the American Academy of Pediatrics, and I could go on and on. So really, like I said, there's an abundance of science on there about the effectiveness of masks. There's also a lot of studies that have been done regarding that distancing, which helps us keep more kids from being quarantined. And it's an overwhelming, really, amount of science. And I know people point to, I saw this article that says you cannot find the abundance of information that opposes masks that you can find that solidly says that this works and it's the right thing to do.
Thanks, Linda. So, Steve, obviously the mask issue, as we evolved in the last couple of weeks in particular, we've seen public input in the form of protests against mask orders and parents speaking out at school board meetings expressing their right for personal choice. I wondered if you could maybe take me through how you take into consideration the concerns of families in school districts who are both concerned about the spread of COVID-19 in the classroom, and those that worry that mask requirements infringe on their personal choice.
Yeah, I mean, we definitely have had a lot of feedback from people who feel strongly that masks should be required all the time, and those that feel that masks should be optional. It's definitely a divided issue, not only in Michigan, but everywhere. and we really do want to factor into what our community thinks. At the same time, we do have to look at this business of going back to our driving question of our plan. Like, how do we, if we all agree that the common ground is that we want our students in school 5 days a week, which I strongly believe is the primary common ground point of our community, that is an area that everybody cares about, then what's the best way to do that? And as Linda's spoken about, if we know masking does work, that certainly would be the way. And there's been some comments, well, there's a lot of young kids that are not getting very sick from this, or, the hospitalization rates are low. And we understand that. Yet, if we have students contracting COVID and thus have themselves and close contacts who are doing a lot of quarantining, that really is not helping us with our driving question of keeping students in 5 days a week, which we know is better for their academic learning and their social emotional health. From the standpoint of parents and community members that are concerned about students wearing masks, we really have taken some time to figure out, well, why? What is that? And you'd mentioned personal choice, but we also feel like a lot of it revolves around social emotional health of students. Like, if students are in masks often, will that potentially impact their social emotional health? And we want to empathize with that and understand that, hey, for some students, mask wearing, we got to be careful that we're allowing some mask breaks and allowing to make sure that people are able to see each other's faces and learn different ways to express emotion, because that has been something that's talked about and some concerns from our families. And we want to make sure that they know that, in the Saline area schools and other districts, we're certainly going to be ready to help support the social emotional health of our students, even with masks being worn. And so we've really tried to look at it from the standpoint of a lot of different viewpoints on this. Yes, we are considering all of them, but we're going to go back to the driving question. What's the best way to keep students in school 5 days a week?
Because I think, to add on to that, there's a social emotional impact to that too. So kids not being in the classroom is about education, and it's also about social emotional issues. So, it is a balance of basically those social emotional issues on both sides, as well as basically the social emotional issues of missing days and days of face-to-face learning again.
Yeah. Great point, Linda. You're right. When they're not in school, that's a key to their social emotional health in a negative manner.
Linda, I wondered, another part of the socio-emotional component of returning to the classroom for a lot of students is their participation in athletics. Can you describe how the health department created mask guidance for athletics in all of the different settings, both indoors and outdoors, and for quarantining for high school athletics for the coming year?
Again, we didn't create any of it. We have not created guidance. Sorry, there's an emergency vehicle going by here. We did not create guidance that is any different from the CDC's. All we did was put it into a format or language that helps our administrators and our school districts understand it. So you're not seeing really a different guidance. So with outdoors, we aren't recommending, the requirement for masking outdoors yet. However, when we're dealing with close contact sports, any kind of close contact sports, both outdoors and indoors, it is certainly advised to have masks unless it is a safety issue with regard to the sport. So all of those things get considered, and we have to take that into account in terms of that guidance as well.
Steve, I wondered if you could maybe talk about what the differences are that Saline and perhaps other school districts across the state are getting from health departments and from the state regarding quarantining for the coming year. I know that's a big concern for parents who want to avoid that disruption. Can we expect that to look any differently this year?
Well, the health departments have been certainly more responsive in terms of figuring out ways that students can still quarantine in school as close contacts. For example, the unvaccinated students that are close contacts can still be in school if they don't have symptoms. They wear a mask and they do tests 3 times a week. And so last year, all those close contacts would have been home for 10 to 14 days. And I think that's in response to the health department or health departments recognizing that, okay, we learned a lot from last year with quarantining. Now, what are some ways we can still quarantine but keep students in school? And that will also help us not having kids out of school. And then again, for those students who are vaccinated, then it will be returning into school with a mask and moving forward. So I do think there's a lot of opportunities to quarantine in school, which means less kids out of school.
Linda, you had mentioned this to me earlier, that prior to the pandemic, school districts and health departments have been working together when there are cases of contagious viruses or infectious diseases in schools for years. Can you explain how they work together to contain these viruses and what type of communication you're having with school districts across the county and what those have been like throughout the pandemic?
So I've been in public health for about 2 decades now and about 15 years as a health officer. And so I've been through H1N1, pertussis, tuberculosis, norovirus, flu, measles, just any number of things with school districts. And really, at the point in time that we're dealing with any of those issues, what I have found is that superintendents of school districts are eager to get the best advice they can get from us because they know they're not the health experts. So they're very eager to have that advice. They're very eager also to follow that advice. They hear us telling them what's going on and what the things that need to be done to mitigate that are. And generally, I've never had a time when I've worked with a school district that hasn't essentially done exactly what was recommended by everything from the CDC to the state health department to the local health department on down. So that's just the way we have collaboratively worked together for years, is that, when these health issues arise, we are there. We are there for these districts to advise them, to give them the information about what it is that they need to do and steps they need to take. We had school building closures during H1N1 for days at a time because that was the right thing to do then, and that was based on a recommendation from the health department. My superintendents used to tell me, it's like, okay, we're going to send out a letter, and can we say that you recommended that we do this, because then we've got this solid. And I was like, absolutely, that's what we're here for. And so that's basically been the relationship we've had in my experience for 2 decades, and I'm sure it was well before that as well. So this last year with schools, same thing really happened. I mean, a lot of recommendations from the health department, a lot of cooperation from districts. We did see statewide mask orders, and those were, really easily followed. We had a period of time where I issued a mask order here when the governor's executive powers went away, and they shifted over to epidemic orders, which are actually issued by the director of MDHHS, not the governor. And, we've been meeting with our superintendents. I know Jimena down in Washtenaw County, I think she meets with you all weekly. I meet with all of mine on a regular basis. Generally, that is really about wanting information, wanting help understanding the information, wanting the guidance to know how to safely move forward. Last year we had a lot of virtual learning and districts trying to figure out, should we send kids back or not? And we had some districts that were very concerned about sending kids back, and many didn't for quite a while over their concern for their safety of their students. Now what we're saying is, please, let's do this. But your concern for your safety of your students needs to stay. We need to still be concerned for the safety of the students. And these mitigation measures, these strict mitigation measures that we can take, are what we can do to get both of those things accomplished: safety and in-person learning.
Steve, from your perspective, when masks are required in schools, what type of kind of following have you gotten from particularly students during this? it's my understanding that, this is something that school districts really haven't had an issue with enforcing, despite some of the different opinions people have about the mask issue throughout the state.
Yeah, I think that's accurate. Our students were excellent with mask wearing last year. Yeah, sure, you have some of our younger elementary students who, pull down the mask or mess with it a little bit, but they're not meaning to be non-compliant, and then teachers simply ask them, yeah, put your mask back up. And I just was really impressed with our student body last year. Uh, all our students are able to wear masks, except for some that have some medical exemptions. Uh, with that said, I feel very confident that moving into this year, our students are going to be just fine with wearing masks again when they're needing to, and very confident with our year.
I'm going to take a question from one of our readers, and just a reminder that you can submit questions on our Facebook page for this. I'll give this one to Linda, kind of paraphrasing one of the questions. Are kids the ones that are spreading COVID-19? I know this is a broad question, but maybe if you had any insights on that.
Children are absolutely part of the spread of COVID-19. Is it just children? No. But we're seeing a remarkable increase in the number of children infected and then the transmission as a result of the infections in children. So there was a point in time, and it varies at any point in time, when about 25% of our cases here locally were in children. So between the 0 to 9 and then up to 18 age group. So about a quarter of our cases. Those do then, it's not like they're also not transmitting. When they're sick with COVID, they do also transmit COVID. So, and they're not always sick even. I shouldn't even use the word sick. I should say ill, because sometimes it's asymptomatic, which is why this is so very challenging, trying to identify somebody asymptomatic. And if you don't, and then that transmission spreads. We had an outbreak here in a day camp program during the summer, just before the school year was about to end. And that was basically, in an unmasked environment, because we're kind of in that realm of before we were saying we really need to be doing this indoors, and they chose not to. And we ended up with about, between adults and children, about 22 that were COVID positive, mostly symptomatic, within an 8 to 10 day period. It was very fast. So that's what we're trying to keep. So yes, they are spreading COVID. They are increasingly representing more and more of our cases, and they are part of the equation. Can we say that it's all because of kids? Absolutely not. We're not trying to say that. But yes, they are spreading COVID.
So, shifting gears a little bit, Steve, I wondered if you could give me some insights into the topic of vaccines, which are obviously endorsed by many school districts across the state, even though, to my knowledge, there aren't any that are mandating that staff get vaccinated at this point in time. I wondered if you could maybe explain what type of guidance Saline is giving for both students and staff, students who are eligible in terms of vaccination outside of a mandate.
Yeah, I mean, we certainly have had a large percentage of our staff vaccinated. You're right that it's not required. When we first were able to have our teachers vaccinated earlier in the year, we certainly had a lot of teachers and staff who are ready to go and be vaccinated. In terms of how we're talking to families about vaccination, we are promoting vaccination. We know that that's a key to moving away from some of these variants that are popping up as we continue on this path. So what we're doing is promoting by way of advertising. When we've had some vaccination clinics in our schools and have said, we encourage this group, this population of students is now eligible to be vaccinated. So when it was the high school level, we had a vaccination clinic at our Saline High School and encouraged people to come out for that. And then when ages 12 and over were able to be vaccinated, we had another clinic that we were sponsoring and promoting. But one thing we are not doing is we don't want our teachers in the classrooms walking up to students and say, "Hey, are you getting vaccinated?" Or that is that choice that parents are making for their kids, and we want to honor that as well.
This is a question for both of you, actually, but I would say maybe Steve first. So that this year in particular, the state is not giving school districts the same type of leeway to shut down district operations or just go completely virtual as it has in the past during the pandemic. I wondered how school districts are going to be working with health departments to determine what needs to happen if there is a significant COVID outbreak in a school or a classroom. And maybe Linda, if you could just add on with that in terms of maybe what would need to happen or what would the metrics of something like that look like, where the health department would need to step in and make one of those types of decisions.
Yeah, I can start with just our own data from last year. We moved back to 4 days a week of in-person instruction right around the time where we were kind of moving through a higher spike around the spring break time. And yes, we were quarantining a fair number of students, but we had almost no spread at all from several hundred students being quarantined at a time. And where I'm going with that is we don't anticipate being shut down this year, in that we feel comfortable that we can move through any of these transmission levels with our masking policy. We have more students that are being vaccinated, and we feel confident that we're going to be able to stay in person 5 days a week. We haven't had discussions with the Washtenaw County Health Department yet on, hey, this is the metric that would take for the county to shut us down. And like maybe Linda could speak to that, because we haven't had that conversation yet in Washtenaw County.
So again, I mean, honestly, when we shut down school districts broadly or school buildings in some cases in any past event, I mean, I've done it with norovirus, I've done it with H1N1, we've done it with any number of things. It's always been a consultative thing. Never ever had a superintendent who didn't want to do exactly what we recommended. You weigh that carefully, and we try to be as surgical as possible with it, because of course nobody wants for kids not to be in school learning. So, you have to look at the situation and where that exposure is. And honestly, the masks help us minimize what we consider to be that exposure and keep more kids in school. So in districts where they're not wearing masks, I would have some concerns about the number of kids that might be out and exposed, potentially sick, because we can't use alternative strategies for excluding kids from school if we don't have these mitigation measures in place, because we can't ensure that we can contain what would likely be an outbreak, as we saw in the example that I told you earlier, which did happen here. And closing down stopped that quickly, but it did actually happen. So it's hard to say. We will avoid at all costs trying to shut down a district. Usually, what happens is and Steve can correct me if I'm wrong, I believe you have to have 75% of your students in for it to be to count as a day for funding, something like that. And usually, when you're starting to creep towards having that 25% of your kids excluded, that usually is a signal that it's a good time to take a pause and kind of get a stop in the transmission cycle. So what these pauses do is just like put a hard stop in a cycle of transmission and allow you to get everything kind of settled back down and restart. So that would be district wide if you got to those numbers, but you can look at classrooms, you can look at buildings. My concern in an unmasked environment, let's give a kindergarten classroom, for example. They do circle time. They do lots of different things that is not sitting at their desk. I haven't been in a classroom in a long time, but I have a granddaughter that's a first grader, so I'm not sure how it all works these days. But in that particular environment, if we're not wearing masks and a kid comes in sick, then the contacts that are within 6 feet of them is likely to be many and could very well be the entire classroom. And then when you're in the room for many, many, many hours, you have to take that into account as well. even when you're thinking about beyond 6 feet, because that exposure risk and that air in the room that has, no filters, no masks, no nothing to prevent, that propulsion of air and droplets, for distances, just becomes, multiplied over hours and hours of time, and makes us very concerned. So we do the best we can to not exclude, if we can figure out ways to not do that, and see that we've got these measures in place. But in a non-masked environment, I am concerned. I'm very concerned that entire classrooms will have to be excluded from school in certain settings, and in particular kind of teaching environment settings. So.
All right, I think we have time for one more question here, and this could be for both of you. What are some things that parents should keep in mind or prioritize to ensure that their child stays healthy and limits their chances of getting COVID-19 this school year, and what is in their control?
So Steve's looking like Linda should start on this one.
Yeah, I was thinking.
Well, I mean, we have advice out there. We have advice from the CDC, and, your kids clearly can pick up COVID, from somewhere else and bring it into school, which then affects all of the children. So obviously just staying healthy in general is always good for us, rest and proper nutrition and all of that sort of stuff. But in addition, you might want to think about what your kids are doing in, say, crowded indoor situation outside the classroom, so that you don't have a non-classroom exposure that also impacts that face-to-face learning. So those are the kinds of things. Again, wash your hands, cover your cough, stay home when you're sick, wear a mask when transmission levels in your community are high and you're in crowded or not even crowded indoor situations. I was with my granddaughters yesterday and went into a Meijer store, and the masks went on when we went into the Meijer and they came off when we left. And I want my granddaughter to start first grade next week when it's time for her to start school. And I want her to have an awesome first grade year. And we will do everything we can in our family to make sure that happens. And I recommend that others do as well.
I'll add on to that from the social emotional aspect. I think mindset matters in terms of keeping kids healthy. How parents talk to their kids about wearing a mask, or, hey, we're looking towards a brighter future. You're helping with common good here as we move forward, and just feeling positive about, you're wearing a mask for a reason, but you're gonna stay healthy as a result of it, and it's gonna keep you in school, and promote it in that way. I think there is that aspect that Linda mentioned before. The social emotional aspect of not being in school 5 days a week is a big deal. So it's mindset on how you talk to your kids about wearing a mask, I believe.
Great. Well, again, thanks so much, both of you, Steve and Linda, for taking the time and helping parents and families understand how decisions regarding mask policies and COVID-19 policies are made in concert between school districts and the health departments. So again, I appreciate you both taking the time, and good luck in working together in the coming school year.
Yeah. Thank you.
Thank you.